by Dr. Wuyue Yu of New York University, a postdoctoral fellow who focuses on cardiovascular and respiratory issues related to air pollution. Dr. Yu will talk about NYU's research on the 2016 closure of the Shenango Coke Works on Neville Island and implications for the U.S. Steel Clairton Coke Works.
Today my talk is going to be more about the potential health benefits of Clairton Coke Works emission reduction based on the lessons we actually have learned from the shutdown to Shenango Coke plant. The motivation of our work here is basically to look at an example of a real shutdown and see whether or not we actually see a real health benefit. We'll first look at the underestimated health impacts of coking-related air pollution. Dr. Gento gave a very good description on the air pollution and health effects itself. So I'll be skipping a little bit in there, but focusing more on how coking-related air pollution might be more toxic than other species. A reminder of air pollution has systemic effects throughout the body. We have heard a lot about respiratory disease, mortality and morbidity, potentially lung cancer and pneumonia. Air pollution also is associated with infectious diseases. There is cardiovascular disease impact. We've seen causal effects with myocardial infarction, heart failure, and we see stroke, diabetes, high blood pressure, and reproductive health effects like premature birth and decreased birth weight. So the effects is actually throughout the body. And why is coking-related air pollution more concerning than other sources? If we look at air pollution, they do come from different sources. There is wildfire, there is traffic-related air pollution. We see different emission sources in our life every day, but coal-related or coking-related combustion from fossil fuel could potentially produce a more toxic type of particle that goes into the air. From coal-carbon emissions, we see higher concentrations of SO2 and hydrogen sulfide produced. Hydrogen sulfide will be oxidized into SO2 in the air, and SO2 is a major airway irritant. From combustion sources, these particles are actually smaller in size. PM2.5 is smaller than 2.5 micrometer, but most of the combustion sources, the particles that comes out with is under 1.0 micrometer. With the SO2 that is already in the air, they will capture and be a vehicle for those SO2 gases. These particles, once they actually enter the respiratory system and into the alveolar region, they can actually cross the boundary between the alveolar region and our blood, and then translocate to other parts of the body. These particles, once they go systemically, could have effects such as longer-term COPD, asthma pathogenesis, decreased lung function over time, and also induce sclerosis, coronary artery diseases, and sudden cardiac deaths. Also, in addition to SO2 and the smaller PM particles, coal-carbon emissions also contain large amounts of volatile organic compounds, benzene and polycyclic aromatic hydrocarbons, and so on. And coal-carbon emissions in general is classified by the EPA as a group A, known human carcinogen. So they're causal for lung cancer. Comparing coal versus overall PM2.5 effects, this is a comparison using pooled analysis of previous source-specific epidemiology. So basically, previous researchers have looked at effects from coal-related PM2.5 and the overall PM2.5. What we found by pooling their estimates is that coal-related PM causes all-cause mortality at a per unit mass basis. It is 3 times more likely than the general PM2.5 particles. What may actually make it worse is that coking essentially is a coal purifying process. The process of coking is essentially purifying coal to more pure form of carbon, coke, and all those impurities is actually released. Comparing coal versus the remaining versus the released in the product. So we're seeing that the coking process will actually release large quantities of arsenic, lead, chromium, and cobalt, which are all known like carcinogenic or toxic metals. So we were interested then to look at the actual closure of the Shenango Coke plant. The Shenango plant was built on Neville Island around 1930. It's around 10 years after first Clairton Coke battery was built, so they were roughly from the same time period. The Shenango Coke plant was closed on January 7th, 2016. The last day of operation is 6th, and the emissions actually continued into the night. So before the closure of the Shenango Coke plant, the production size there was around 10% of the Clairton Coke Works plant, and its emissions differs by type of particles and gases we look at, but it's roughly 10% of PM, 20% of SO2, and 35% of volatile organic compounds released compared with Clairton Coke Works. So somewhere around the 10 to 20% of the actual emissions from Clairton. The residents have been subjected over there to high levels of exposure and have been protested for years before the closure. It is eventually the community pressure and decline of domestic steel industry together that actually made the shutdown happen. We looked at the air quality and actually health impacts of the shutdown. Shown here on the right-hand side is a dispersion model. Dispersion modeling done here is using the emissions from different parts of the facility. We consider different points and different lines as the emission sources, and used the geographical terrain pattern and the weather pattern in the area to see where the pollution from this plant actually is going to go. In the model, we see that from the shutdown, the actual decrease of PM 2.5 will be up to 0.35 microgram in the zip code right next to the plant, not on Neville Island, in the Avalon zip code. In that area, we saw it up to nearly 1/3 of a microgram decrease solely from the Shenango emissions. Taking a closer look, our health research basically took place in these neighborhoods, going from Shenango plant, the zip code surrounded and a little downwind. We looked at for air pollution, this one. Here's a Allegheny County Health Department air quality monitor. That monitor is located right across the river from the Shenango Coke plant, very close. And at that monitor, what we actually saw was a 90% reduction of daily SO2 levels right after the emission. And at the same air quality monitor, we also saw a 0.8 microgram reduction of daily average PM 2.5 level. In the neighborhood, we actually looked at health effect. The health effect endpoint we used is further up that pyramid. We look at emergency department visits so it's more severe cases. In terms of cardiovascular effects, what we saw in the Avalon or the near Shenango site is that we're looking at a figure showing in those over 65 years of age, the cardiovascular emergency department visits were on the increasing trend before the closure. Right at the week after closure, we saw a 19% reduction of the emergency department visit rate. And that's not just it. It kept going down over the years because the effect itself is actually systemic, and our body will actually heal and clear all the particles over time gradually. So we did see both an acute and a longer-term health benefit right there. If we look at injuries as a control outcome, which is supposedly not really impacted by air pollution directly, that did not happen. So the shutdown of the Shenango plant at that time point is actually inducing only effect in the biologically plausible or the cardiovascular effects here. During the same time, there is a unchanged also upward trend near the Clairton plant. We see a slightly different pattern. The respiratory emergency department visits dropped immediately after the Shenango Coke plant closure. The drop there, this is for all age in the same zip code block groups. So what we are seeing there is that there is a roughly 20% decrease of weekly respiratory emergency department visits, also right after the shutdown of the coke plant. It went on very similar trend as before. So there is no real longer-term health changes in the respiratory emergency department visit outcome, but the 20% decrease is still there. At the Clairton neighborhood, the story is different. The Clairton neighborhood actually had a larger and increasing number of respiratory emergency visits over the years. It is even higher than the predicted trend using the pre-closure years. This is for pediatric asthma visits. So what we did see in Dr. Gentao's presentation is that the increased air pollution has caused an increase of absenteeism related to asthma. And here we're looking at a slightly different direction example. If we decrease the air pollution, we will see a decrease in asthma emergency department visits. Here we saw that the monthly pediatric asthma emergency department visits at the physicals near Shenango Coke plant was reduced by around 40% right after its closure, and it also kept going down over the years. Meanwhile, near Clairton, these kind of change did not really happen, and the numbers has been increasing more recently. Seeing the health benefits at Shenango, we ask what if? So what if we actually reduce air pollution at the Clairton Coke Works? This is a dispersion map looking at in the scenario of shutting down batteries 1, 2, and 3, which actually happened, consists of around 20% emission numbers from the baseline years. And we're seeing that according to our model, the annual average reduction is estimated up to a 0.2 microgram in the closest zip code to the Clairton Coke Works. That is around a little bit more than half of the biggest reduction we see from Shenango shutdown itself. The total emissions from Clairton is larger, and they will disperse a longer distance. So actually more zip codes will be impacted by the Clairton Coke Works emissions than by the Shenango plant. So a reduction of Clairton plant is going to actually give us a larger, much larger area that is going to see a comparable health benefit. So what if we have an even larger reduction? Here we're looking at a case scenario if we are cutting the emission from the Clairton Coke Works by half using the 2022 levels. So in the case of 50% emission reduction, we're actually going to see large health benefits and large air quality benefits, and the biggest reduction number is estimated up to 0.37 annual average level. That is around the biggest decrease we actually see in the zip code next to the Shenango plant. Here we're seeing more potential for public health benefit. So the implications are there is significant health benefits actually seen in the community residing near the Shenango Coke plant after shutdown. And reducing harmful emissions from the Clairton Coke Works can actually bring clean air and public health benefits to communities residing in the Mall Valley. So what can and should actually be done? One key thing is for sure to clean and modernize operations at Clairton Coke plant. Nippon Steel actually had some communications talking about the methods they want to actually use called Super Course 50. It is basically a hydrogen, they're going to inject hydrogen in blast furnace in steel making. It is not dissimilar as the cleaner direct reduction iron making technology. What it does is just adding hydrogen in the process. It still uses coal. Because hydrogen is added and there's carbon sequestration in the later phase, it can partially reduce its CO2 emissions, greenhouse gas emissions. However, the toxic components we talked about, it is not really clear whether or not it actually reduces those from the coating process and from the emissions. It is very important to have a better accident and violation prevention system. That means inspection, maintenance, and upgrading the facility. And also more active communications with local residents. Also, as Dr. Gentile have suggested, we need a better monitoring and alert system. One thing is to properly fund the Allegheny County Health Department's air quality program. And also, it is necessary to actually create a collaborative personal air monitoring network. We have universities around, we have clinical care facilities around, we have other places where we can actually do air quality measurements. It is important to actually identify the neighborhood at higher risk and establish effective and real-time monitoring network in these communities. We need air quality monitors where the children are, where the older adults are, where those who may actually already have chronic disease are. They are the people who actually need their air quality exposure levels measured. And we need an air quality alert system that is going to be communicated by different channels so that it reaches everybody. It's not only that a alert that will tell you we are now in high air pollution episode. It also has to include what you should do. Should you stay inside, use mask like an N95, or should you have a filtration system on? So together, we could possibly utilize this as our public health opportunity and clean up the Clairton Coke Works. Right.